You know that sound? A sudden impact, a sharp crack, and then a trip to the ER. A broken collarbone is one of those injuries that's just incredibly common, happening to everyone from pro athletes to kids who fall off their bikes. In this explainer, we're going to dig into what exactly happens when this really important bone snaps.
And I'm not kidding when I say common. The clavicle is legitimately one of the most frequently broken bones in our entire body. It's got that gentle S-curve and sits in a pretty exposed spot, which, makes it super vulnerable to impact.
But what really goes down when it breaks? Because it's not just a simple crack. It's actually a pretty complex injury. You've got muscles, ligaments, and all these pulling forces involved. So let's follow the journey, right from that moment of impact all the way through the road to recovery.
Okay, so to really get a handle on the fracture itself, we've got to talk anatomy first, because it's all the stuff around the clavicle that really determines how a break acts and ultimately how you need to treat it. The absolute key to understanding pretty much any clavicle fracture comes down to these two little structures, the coracoclavicular ligaments. We just call them the CC ligaments. I want you to think of them as these super strong anchors. They are the main stabilizers holding the clavicle down, and whether they're intact or not is pretty much everything when a doctor is sizing up a break.
So, the second that bone snaps, this dramatic tug-of-war kicks off inside your shoulder. You have this big muscle in your neck, the sternocleidomastoid, that yanks the inner piece of the bone upwards. Meanwhile, the weight of your arm and your pec muscle are pulling the outer piece downwards. That is exactly what creates that classic, obvious bump that you can so often see right through the skin. So where do these things tend to break? Well, it's not totally random. The huge majority, we're talking 80 to 85% of them, happen smack dab in the middle, in the midshaft. Breaks at either end are way less common, but a breakout near the shoulder, at that lateral end, that one comes with its own special set of problems.
Right. So once someone gets to the hospital with a suspected fracture, the doctor's #1 job is to figure out just how bad the damage is. And this whole assessment, it's absolutely crucial for deciding what happens next. The physical exam is basically a 3-point inspection. First, they look at the deformity. There's a sharp piece of bone pushing the skin up into a little tent. We call that tenting, and it's a huge red flag that the bone is about to pop through. Second, they check if the skin is already broken. And third, and this is a big one, they check the neurovascular status. See, the main arteries and nerves for your whole arm run right underneath the clavicle, so any damage there is a really serious problem.
Now, for those less common fractures out by the shoulder, doctors use this specific system called the Neer classification. So a type 1 is stable because the break is outside of those super important CC ligaments we just talked about. A type 3 actually goes right into